Self.
To sell.
Yeah! Hey everyone, welcome back to Cells to Sell. My name is Heem, this is Nick, and we have a very special guest with us here today. His name is Will. You want to introduce yourself?
Yeah, hi everyone. So my name is Will Wulftange. I'm an MD PhD student here at Case Western Reserve University, and I'm about 5 years deep into the program, so about halfway through, and excited to talk. Halfway through, only half a decade left.
Oh, God.
That's crazy.
Yeah.
So what part of your MD PhD are you doing right now? And for those who might not know what an MD PhD is, just kind of give like a little bit of a background.
Absolutely. So an MD PhD program or a training program is for people that can't really decide between research strictly or medicine, and so typically the program is laid out, you do the first 2 years of medical school, and then you do your PhD, which can range anywhere from 3 to 5 years, and I'll probably be on the 5-year end of it. And then you go back and do the last 2 years of medical school. So those are your clinical years. And so it's a really long program. It's kind of daunting to be like, yes, I'm going to commit to this program for the next decade of my life.
Did you go to undergrad at Case?
No, so I am from Reno, Nevada, and I never cared about school or academia. High school, it was just I just didn't care about any of that stuff. And then once I got to undergrad, which I also did in Reno, Nevada, so University of Nevada, Reno, I was like, oh. I looked at my friend on orientation. I was like, "What should we do?" And he's like, "Let's be doctors." And I was like, "Yeah, that's a good idea. Let's do it. What do we have to study for that?" And so we went into the biology track. And I actually, switched to chemistry halfway through because I realized that I like that more. But
so in high school, did you have any AP classes you took for biology, chemistry, or anything?
I did take some AP classes. It was mostly more on the math side of things. That was kind of my strong suit. And like I said, I wasn't really engaged in school in high school. It was just it did not interest me. And I felt like I had a teacher that just was fighting me at every turn. And so I still think of she was wouldn't let me progress to the upper level math. And I was like, Miss Whelan, why are you doing this to me?
Holding you back.
Yeah. Well, now I think I sure showed her I'm so good at school now. So yeah.
That's awesome.
Yeah.
So you're from Nevada.
Mm-hmm. Yeah.
I did not. I don't know why.
Yeah,
but
yeah.
So we always ask somebody a geographical question, and I'm really interested now
Okay.
hearing where you're from.
Sure. Yeah.
But coming from Reno to Cleveland.
Yeah.
You've been here for 5 years now.
Yeah.
Was it a kick in the teeth with
No.
the cold or what?
Okay, so people get this mistaken about Nevada. So Las Vegas, when people hear Nevada, they think Las Vegas, right?
Yeah.
And Las Vegas is super hot,
dry heat, desert.
all day. Reno is about, if you're going 80 miles in a straight line through the desert, it's 8 or 9 hours north. So it's really far away.
Oh, wow.
Really?
Yeah, and so in Reno, we actually get all 4 seasons. We actually get more snow in Reno than we get here.
No way.
Yeah, last year we got 12 feet of snow or something in the mountains and stuff. So
Lord.
I was not ill prepared or anything. And I didn't come straight from Nevada to here. I actually bounced around a little bit, which I'm happy to get into. But yeah, I took quite a few gap years in between undergrad and this program. So.
Okay, that was going to be my next question. So, how old are you, and what was your journey from undergrad to MD PhD? Because that's a really big jump.
Yeah.
I went to school at Thomas More with a very, very intelligent girl who just jumped straight in.
Yeah.
She's 22, maybe even 21, and she's I got accepted to the University of Cincinnati in MD PhD program, and she was all about it. And I was like, that. Your 20s are gone.
Yeah.
Where'd they go?
Absolutely.
So what was your kind of journey?
Yeah, so I originally, like I said, I was in undergrad. I knew I wanted to do medicine, and I didn't really understand what I had to do to get into medical school. I knew there were lots of hoops and it seemed like a lot of bureaucracy to get in. And I ended up joining a research lab, and I just fell in love. It was a synthetic organic chemistry. So we were synthesizing materials type molecules. And it was really fun. I was like, wow, research is really cool. I really enjoyed it. Mm-hmm. And I was like, I want this to be part of my career. But I wasn't sure about MD PhD. It seemed kind of daunting. It just didn't seem in the realm of possibilities. And so I applied to medical school, and actually I did not do well in my first application cycle. I only got one interview, and that was at the University of Nevada, Reno. And so I remember I was like, if I go to medical school here, I'm going to be here for my entire life.
You're stuck.
This is right after undergrad?
This was my senior year of undergrad.
Okay.
And so I'm applying. And I'm like, this was my senior year, guys. And I was like, I've been in my hometown my whole life. I want to, I gotta get out and see other places because I didn't go anywhere for college. And so I was talking to my PI in the research lab, and he was like, I was like, what are my options if I wanted to pursue chemistry? for grad school because I knew I loved research. And he was like, well, like you could probably go pretty much anywhere you wanted, but I have a bunch of connections in Europe that are trying to establish pipelines between like the U.S. and Europe, trying to get American students over. And he was like, so that's a possibility. I was like, well, that sounds pretty good. Like,
awesome.
I wanted to get out of my hometown. So what I did afterwards is the first application cycle of med school wasn't really panning out. So I pulled my applications that were like still pending, and I ended up going to Germany to do a master's in chemistry, actually.
No way.
Yeah, so I was like, this is like this. I really got out. I like left the U.S. and I was like in Germany and I did a master's there for a year. So.
That's awesome.
That's incredible.
It was cool. It was a lot
I
of fun.
remember in undergrad, my organic chemistry teacher would always try to push us towards grad school in chemistry because they're like, he's like, it's the greatest deal ever. You go get basically a free education. You TA, they pay for housing. You get an allowance for food, and he's just like, you get to just go live. Yeah. And like, so what was Germany like?
Germany was great. It was a huge culture shock when I got there. I had never been to Europe. I had really never been out of the country, like maybe to Canada. But I got over there and I was like, I couldn't speak to anyone. I couldn't understand anyone. I couldn't read anything, and I didn't know anyone over there. So it was like it really kind of pushed me. My whole life, I was like an INTJ, like the Myers-Briggs personality or whatever. Do you guys know what that is?
No, I have
not. Okay.
The personality test.
Yeah.
Right?
So basically, I'm like super introverted. So when I got over there, I had to like really push myself to become extrovert. I just had to like say yes to every opportunity people would like extend to me. Like, oh, you want to go out? Like, yes. When I really did not want to go out. But anyways, it was really great. It was so fun to kind of see these other cultures and see how all these different people operated. But at the end of the day, Germany had so many like regulations. It was like, oh, you can't take your trash out between 2 and 3 p.m. on a Sunday because that's quiet time and it makes too much noise if you take your trash out.
No way.
And people in Germany are very like strict to their contracts. Like even if it's gonna like disadvantage them, they'd be like, that's not in my job description. I'm not doing that. And like that's why they wanted to get Americans over there because Americans are just like, oh yeah, sure, I'll do that, no problem. But ultimately, I was like, this is not for me. And I also realized that I didn't really like chemistry that much because you're working with carcinogens all day. And like I worked with this guy who like one day his hand was like under the UV light and his like arm was glowing yellow. And I'm like, Simon, like, don't you see that? Like, aren't you worried about that? He's like, oh, we're all going to die someday. And I'm like,
it's quality of life. You could develop diseases from that.
Right. Oh, yeah.
Oh, my gosh.
So I was like, I got to get back to the U.S. and I got to get back towards medicine. So, so that was my stint in Germany. Super happy I did it, but like.
So that's awesome. That's crazy. Like, no. I've never met anybody who's ever just been like, I want a chemistry master's. Let's go to Germany. Yeah. So did you learn German? Like
I learned German. It was really helpful, like being immersed in it. And then by the end of it, I could like cancel my phone contract, close out my bank, and all that kind of stuff. I've pretty much lost most of it. I can still kind of read it. I can still say some phrases, but
I think my favorite word in German is birth control pill because it's literally anti-baby pillen. Yeah. It's like an anti-baby pill.
Right. It's like they're so literal over there. Like
it is so literal.
Like shoes is like Schuhe. And then gloves is Handschuhe. Like it's so literal. Everything is so literal over there. There's no fluff. It's all.
So let's get back. So now you're here at Case. Yeah. MD PhD.
Yep.
When after your master's? Like
how long after your master's did you?
Yeah. Okay. So after my master's, I knew when I was writing my master's thesis, I found biomedical engineering. Actually, I was kind of like writing. Like I was working with carbon compounds, and I was like, okay, how can these be used? And that's when I read about like nanoparticles and like drug delivery systems, and I was like, oh, like this is actually cool because like in chemistry you synthesize a molecule, maybe you write a paper or publish on it, whatever, you put it on the shelf and you never think about it again. And I was like, that's super unfulfilling. Like you don't see the products of your work. And so I was writing my thesis, I found about like drug delivery vehicles and stuff like that, and I was like, whoa, this is really cool because you can actually like see these things applied potentially like either in the lab or potentially in the clinic, and so I was like, well, I want to transition into biomedical engineering, but how do I do that? Like, and I knew at that point I wanted to do MD PhD, but I was like, it's going to be a tough sell having never taken any engineering to like let programs enroll in that. So after Germany, I actually went to the Washington D.C. area to do like the NIH. They have like a little post-bac program, so I worked at the NIH for like a year and a half in a biomedical engineering lab.
That's right.
Doing like organ on a chip type stuff. So that's kind of how I got into the field, and I was like, I loved it. I was like, this is where I'm meant to be. Like this, I love doing this. It's so cool, so fulfilling. And during that time, I applied to Case, and that's kind of how I ended up
Did you know about Case Western, where it was? Because, like, it's such a good school.
Right.
And, like, no one knows about it. No one knows where it was. Like, that's a story for us. Like, we didn't know.
Literally, I had no idea what it was
until
I applied.
Yeah.
It was crazy.
So I had only heard, actually, my grandma went to the Francis Payne Bolton School of Nursing, and my grandfather went to the School of Medicine here back in, like, the 40s. So I had heard of it, and they talked very highly of it, and I was like, Cleveland? Like, okay, whatever. Like, I had no impression other than it was like Ohio. Like I'd never been to the Midwest and like, but yeah, so I had heard of it, and then when I interviewed here and came here, I was like, oh, like this is kind of cool, and like this is where my grandparents went, and I've since like fallen in love with the Midwest. Like I could see myself staying here forever potentially.
Wow,
I love the Midwest.
Awesome. That's hilarious because so many people come to the Midwest and they just are like, damn, this place sucks.
Yeah, you gotta appreciate it, but you gotta see the beauty. You gotta see the beauty in things, and that's like. The Midwest has so much to offer. It's so beautiful. It's like cost of living is low. Like people are so wonderful here, and you can really like be really impactful here.
Yeah.
You know, if you go to like personally, and also this goes back to like I'm super introverted, so like being in a big city like New York or something, it seems like terrible. Not something I would exactly want to do. But yeah.
Yeah, the Midwest is pretty cool.
I love the Midwest. So
in DC, you were doing organoid chip stuff, but you were intentionally going there for drug delivery nanoparticles. So how did you find that? And from there, how did Case happen?
Yeah, so I went there. I kind of Googled, like, I was like, okay, like, how can I go? I need to do, like, a lab tech or, like, some sort of, like, entry-level position into BME. And so I found this NIH, it's called the NIH Intramural Research Training Award or something. You basically just go there. It's like a post-bac program.
Yeah.
And so I applied, and having a master's, most of the people applying to this were, like, had bachelors. So I was, like overqualified. So I actually just submitted my application, and a lab serendipitously like reached out to me, and it was the microfabrication and microfluidics core, and they're like, this is exactly like what, you're really overqualified for this position, like, and like, would you like to come work? And I was like, this is exactly what I want to do, because like these are the technologies I want to learn, and like I feel like, and so I went there and I worked on a really cool collaboration project where we were microfabricating it's like a little array of pillars, and we would perfuse oxygen through the pillars, and cells would be growing around the pillars, and the whole idea is that like you could by perfusing oxygen through these pillars, it would create like an oxygen gradient that's more physiologically relevant for these cancer cells that we were growing.
Wow.
And I was like, this is awesome. Like,
that sounds so cool.
Yeah, in practice, it was like pretty low throughput, but it still was like kind of a cool like novel cell culture system, and it like I was like, this is what I want to do, like, for sure. And that's, like, technically, it wasn't organized, it wasn't a chip, but it was, like, the same principles. Like, there wasn't flow or anything, but, like, microfabricated structures and that kind of stuff.
So now that you're at Case, you've done your first 2 years of med school. Did you have to take your boards after?
Yes, so I took the first, you do step 1, step 2, and step 3, and I was taking step 1, which is all, like, it's just, like, a huge test based on, like, the preclinical knowledge and that sort of thing. And I was taking that, and usually it's like 7 to 8 weeks of like 15 hours of studying a day, like very intense. And COVID hit actually while that happened. So all the testing centers shut down. So what should have been 7 or 8 weeks got extended to like, I think 2 or 3 times that, just because we're just waiting for the testing centers to open up. And that was actually really bad because like over 7 or 8 weeks, you start to forget what you studied at the beginning. So like there's a sweet spot between like studying enough, but not so much that you're going to forget stuff you learned 2 months ago.
Right.
And so it was really horrible because it was like you're just trying to study enough to like maintain the knowledge but not forget all the stuff that you studied. So it was a horrible process, but like it was
Sounds like taking the MCAT during COVID.
Yeah, right, exactly.
It was awful. It was terrible.
Yeah, same thing, I'm sure.
Horrific.
Yeah.
Trying to take classes on like you're already taking 6 classes online, you're trying to take a night class online just for the MCAT.
Yeah.
You're done looking at the screen from all day.
Yeah.
So now that so you got through the boards, got through the first 2 years.
Yep.
So in the lab that you work in now, what are you, what kind of projects are you working on?
Absolutely. So I'm actually doing a co-mentorship between 2 labs. So one is Umut Gurkin in the mechanical engineering department, but he's a BME professor position. So that's my primary lab. And then I also work with Paul Tazar, who's in the genetics department, and he works with like stem cell stuff. So they do stem cell work to grow like oligodendrocytes and astrocytes, kind of glial cells to study like those types of, white matter diseases or like MS and that sort of thing. And so the cool thing about organ on a chip, microfluidics, all that kind of stuff is like you can make these really cool platforms. But most of the labs that develop these are like heavy engineering labs. So you can make these platforms and culture cells in there, but like you don't have the expertise to like ask really impactful biological questions. So what's really cool about a lot of these projects is they're highly collaborative between like, a biology lab and engineering lab. And so that's kind of like this dual mentorship that I'm doing is like fairly common in this space. Because it's not cool to just develop a device and be able to grow cells in it. Like no one cares about that. You have to show that this device is useful and can produce data that you wouldn't otherwise be able to produce. So
in one of my classes, we're actually going over an invention by Paul Tazar and Matthew Ellett using antisense oligonucleotides or Pelizius-Merzbacher.
Yep, absolutely.
Cutting out the PLP1 gene.
Yeah, exactly. That was like a very cool paper came out not too long ago. But yeah, both Paul Tazar and Uma Kirkin, I like what they're doing in academia because they actually take their research and they spin out startups. So they both have those fairly extensively.
And that's one thing that I've talked about kind of on this podcast, and what we were talking about before is there's a difference between like the academia mindset of just spitting out papers from your lab and putting them back on the shelf and never touching them again, like you said in the chemistry lab.
Yeah.
But when I come up here at Case, the environment and the thought process of doing research is so different.
Yeah.
Because they want to get results and spin them off and sell them.
Absolutely.
And I think that is something that people, as creative as the school system is in the United States and the research labs and what comes out of the United States, so many people are still just bogged down and I just want to get a paper out.
Yeah.
Whereas take it to the next step. How can you apply this and how can you put it in the market, to make some money, get a startup going and, sell it to, pharma or even big pharma.
Absolutely.
I think that's so important. And I think that what those guys do, I work in Dr. Amar Desai's lab over in Wolfstein, and we study hematopoietic stem cells and how a bunch of different things affect them. And he has been part of a Case spin out.
Yeah.
And
which one is that?
Oh, which one did he do with Gerson?
Rhino Therapeutics.
Yeah.
Oh, okay.
So that it got bought out.
Okay.
But he's still doing work here, and I just think that sounds way more fulfilling than if he were to just find something really cool and then just put a paper out.
Yeah. Oh yeah. That's I think that is the coolest and that's actually what drew me to Case specifically is like when I was applying to all the MD PhD programs, I was looking of course of like what kind of research was there and like the school and all that kind of stuff, but like what I knew I wanted to do was like I wanted to do that entrepreneurial stuff. Like I knew I kind of wanted to spin out startups. Like one thing about me is like I really don't like authority. Like I don't like having too many people above me. Yeah. And so the idea of a startup was like super attractive, like kind of running your own life, not being beholden to like too many people. And so Case was like really supportive of like they have tons of biotech incubators. They've got like the Harrington Discovery Institute. They've got like the Veal Institute of Entrepreneurs. There's so many programs, and I haven't participated in most of them at this point. Of just like training people to like become an entrepreneur, to like patent and license your technology and that kind of stuff. Like that, they've got the Coulter Wallace grant or like all these kind of incubator programs to like push out technology into the market, and that was one of the biggest draws.
And I think it's cool because it's not just trying to push out their PhDs.
Yeah,
it's for students.
Right.
It's for people to come here with ideas, get an education while you push this thing out.
Right.
To set yourself up for the next 5-10 years to do work and then potentially make that your business for the rest of your life.
Absolutely.
Or sell it off.
Yeah.
And that sell off could be a very, very nice paycheck.
Yeah, collect some royalties and stuff.
Yeah, exactly.
Yeah,
I think, so that's one thing that really attracted me to the RGME program was the regenerative medicine part's cool.
Yeah.
But the entrepreneurship part, I'm the same way. Everywhere that I've worked, I've been kind of like a manager. Don't have too many people above me.
Yep.
I'm helping make decisions. I hate sitting there in a meeting and just being told exactly what to do.
Yeah.
Whereas I like the managing part. I like being involved in all the moving parts.
Right.
But also understanding all the moving parts.
Yeah.
And I think that is a quality that I have attained just from I've worked a lot of jobs. Okay. I've seen a lot of things, but it's that mindset of what I do for work.
Yeah,
I will reap the benefits, not the people above.
Right, absolutely.
Right. So I think in Case gives you almost every opportunity to do that, and it's awesome. It's so cool.
I completely agree. Like that's
so cool.
So integral to like a lot of their training programs. Like a lot of the grad students I know, both MD, PhD, and regular PhD, like they like a lot of them come out of their programs with like patents. Yeah. And that's not common. Like that's a really cool thing to like be able to do here.
I think it's incredible.
Weren't both of your PIs didn't they get inventor awards this year?
Yeah, they did. So I think
I was at the thing where they were
that's really cool.
They were given 3D printed medals.
Oh, really?
Yeah.
That's super
So there was like a collaboration from literally the whole university for this like event.
Yeah.
All the different people like Tazar and the microfluidics.
Yeah, Gherkin.
Yeah. They were both panelists, so they got to speak up there.
Yeah.
And they got to receive a bunch of awards.
Man, that's
and you're connected to both of them. Like,
yeah.
Dude, you're doing some like top notch stuff. That's
well,
awesome.
I have a good network of people around me. Like I was thinking about that the other day. Like it really helps to be surrounded by a lot of like really, people that are like doing the things you want to do, research and like this entrepreneurial stuff. And like I think I don't know if I know what event you're talking about. I don't remember what it was for, but I think it's because they both got elected to the National Academy of Inventors or something like that.
Wow.
They both have startups, patents, and like have been fairly successful in that sort of thing in that space. So like that was a huge reason for like kind of forging the collaboration between the two. Is like you guys are both doing exactly what I want to do. So
how did you find them? And like so when you applied for your PhD, did you rotate under their labs first, and then you were like, hey, this is cool?
Yeah.
Okay.
So I knew that I wanted to do like tissue on a chip, right? And so what tissue on a chip, I'll kind of briefly explain that. So most cell culture, most of the like work that's done in the lab or in vitro is done in like Petri dishes, right? Or like little plastic flasks.
Right.
And you can imagine this is not physiologically relevant, right? Because like
it's flat.
Yeah, it's flat, it's plastic, it's like
the cells grow in 2D, they don't grow 3D.
Right. You're exposed to like room oxygen, which like none of the cells in your body are exposed to room oxygen basically. Like a very few, your skin and like the top in your mouth basically. And everything below that is like hypoxia relatively. And so and then also there's no mechanical forces. Like they're just sitting stagnant. And so the papers that I sent you were by kind of one of the creators of this field, Donald Ingber. He's at the Wyss Institute in Boston. And what they showed back in like the late 90s, early 2000s was basically they took these like microfabricated structures of different sizes and shapes and geometries. And my favorite paper probably of all time is called The Geometric Control of Cell Life and Death. And what they did is they microfabricated these structures, which was a novel technology at the time. And they put single cells or like maybe a couple cells on these things. And what they discovered is that, the cell would live or die based on how much area it had and what shape it was on. So they're like, so these cells are like really sensitive to their mechanical environment. Like,
wow.
And so that like, it was a science paper. It's been cited thousands of times. And so that's kind of when it occurred to people like, well, like we should be considering the like mechanical and like physical environment that these cells are in. Like a plastic dish, surprise, surprise, is not a great environment to grow cells in. And that's why, in that kind of like cell therapy or like pharmaceutical pipeline, you start out with like, it's like a pyramid. You have a bunch of in vitro models, you move into animal models, and you kind of thin out the like potential applications. And so my whole research is like focused on that bottom model. Let's create the most accurate in vitro models that we can to kind of, if you create more accuracy on that level, you could shave off billions of dollars in that pipeline.
Oh my God, not even that. Like, if you wanted to get allergy tested, I don't know if this is an application for it. Mm-hmm. So like, let's say you take a biopsy, you take my skin and grow it on a chip.
Yep.
Can you do allergy testing on this chip instead of pricking me 30 times? You know? Like, is that an application?
Oh, absolutely. So that's kind of similar to what my PhD project is. So you guys are familiar with cell therapies. Have you heard of CAR cell therapy?
Yes,
it's like CAR T cells. Yeah. So the way I kind of ended up in this lab was I found Gherkin, and I was like, this is so cool. He does like point of care diagnostics. He worked very heavily in sickle cell, which like I was like kind of impartial to. I was like, okay, like it's not like I have a passion for sickle cell or anything, but I do like the blood and vasculature. I really like that because like, it's present everywhere in every tissue. Mm-hmm. And so he would make these kind of like little microphysiological blood vessels, essentially, these microfluidic devices that mimic blood vessels. And he would test sickle cell on that. And so I rotated through his lab and did a sickle cell project. And I was like, this is cool. This is like exactly what I want to do. But I was heavily interested in like the blood-brain barrier, or like, I kind of like the neurological stuff seemed really cool. It's a little bit more complex. And so that's when we reached out to Paul. And then there was also like funding opportunities for blood-brain barrier that incorporated like whole blood and like human, because most of these models don't work with actual blood. They work with like cell media or whatever. And then we had a person at UH, Paolo Caimi, reach out to UMA, and he said, hey, we work with these CAR T-cell therapies. And there's, I think, 5 or 6 FDA-approved CAR T-cell therapies. They're all directed against CD19 positive cancers, or B-cell cancers, and they give them, what they do is they take them out, they modify these T-cells to attack the cancer cells, they grow them up, and then they basically make sure they're not contaminated, make sure they are doing what they think they're doing, and put them back in the patient. Now, the problem is when they put them back in the patient, anywhere from like 10 to, in some clinical trials, 90% of patients have these horrible inflammatory side effects, like cytokine release syndrome, which is like a systemic inflammation response, or like a neurotoxicity, which goes by multiple names. And these side effects can be like fatal. And they don't know why or how this is happening. They kind of have some mitigation strategies in the clinic. But the whole idea was like, we need better models to study how these CAR T cells are behaving in the lab before we give them to patients. And so, these tissue on a chip, organ on a chip, especially the blood-brain barrier stuff, was like perfect. So it was like a trifecta of like the clinicians, Uma, Paul, and it was like, and so that's kind of my PhD work, is studying these CAR T cells in these novel systems.
All right.
That's
so cool.
That's so cool.
So all right, we're kind of running out of time. So,
Sure.
and I have one last question.
Okay.
And this, it still regards your MD,
Sure.
your MD PhD. So it sounds like you're really passionate about your PhD work.
Totally.
You absolutely love it.
Yeah, absolutely.
Do you think that when you go into the clinic for your last 2 years of medical school, you're going to fall in love with working with patients, or do you think that you're kind of seeing the light from the PhD and seeing what you can do as an entrepreneur?
Yeah.
And then you're just kind of like, I'll go do the 2 years and then just get right back in the lab.
Yeah. So it's been, this is a huge kind of internal struggle for me. Like, how much do I incorporate clinical medicine into my career? Because like, I told my dad, like, I'm not even sure I really want to do residency. And he's like, really? You're going to go to medical school and then not be able to do any medicine?
Oh, gosh.
And so, and I was like, okay, like, that's fair. And I'm kind of always thinking like, okay, what if the world ends? Then I have no skills and like I need, but anyway, so I think the way I kind of think about clinical medicine, I probably will do a residency, either like pathology or internal medicine, just to kind of gain a general understanding. But I'm pretty certain I do not, like, interacting with patients, the way I look at it is like, it's very good, of course, like all my friends are doing it, like so beneficial. But like for me, you can see maybe 20 patients a day, which is great, like, and you're very impactful in those patients' lives, but I feel like you could invent a device that could literally impact thousands of people every day. And so I feel like with where my passions are and like what I want to do, I feel like it would be most impactful and beneficial, I guess, in the grander scheme, to go into like development and that sort of thing, to kind of try to develop these devices to more accurately guide clinical care. So probably my career will not have a lot of clinical practice in it.
That's incredible. And I think that it's really cool that you kind of have an idea of that now. Because
Right.
I feel like there might be some people in your position who are like, I really don't know, like,
Yeah.
that my PhD is kind of cool, but I also want to work with people. And I just think that's incredible. So we're going to cut this off right here because we actually plan on recording a second episode with Will today, kind of on some different topics, but we don't want to make it too long, and we don't want to hold him here too long because we could talk to him all day about this. Him and
I have more questions actually about the chips. But
We barely even got into it, really.
Exactly. So maybe we'll do 3 episodes, or you will be more than welcome to come back.
Yeah, absolutely.
Right?
Absolutely.
Because,
I'd be happy to.
Because we don't plan on stopping this
Sure.
anytime soon, because we find it a lot of fun. It's cool to have people on like
Yeah.
you to learn all this stuff.
Yeah.
Because there are so many people who would hear organ on a chip and be like,
what does that mean?
are you like a potato chip?
Yeah.
Like that kind of stuff.
Right,
So anyways, we just want to say thank you for this episode. This has been great to get some insight on an MD PhD, on kind of the life of an MD PhD student, and how you can impact the world. And I think that's so cool and so inspiring to anybody who's watching.
Cool.
So Heem, I know you have more questions, but we gotta
end it.
we gotta end it. So I just want to say thank you guys for watching another episode of Cells to Cells. I'm Nick. We want to say thank you to Will for coming on, and that's Heem. And have a good one, guys. We'll see you in the next one.
See ya.